Okay, so this is the correct mechanism. So insulin is released through the bloodstream from the pancreas when the blood glucose rise, and insulin binds to the insulin receptors, which causes the GLUT4 channels to open up and let glucose in and into the cell, causing a decrease in blood glucose levels. When glucose enters the cell, the glucose goes through the process of cellular respiration to convert the glucose into energy to fuel the cells like skeletal adipose or muscle tissue. Once insulin is no longer binded to the receptor, the cell regulates the glucose inside of it and lets glucose back into the bloodstream. So there are two types of faulty mechanisms, type 1 diabetes and type 2 diabetes. Type 1 diabetes is when there is not enough insulin being produced, so the GLUT4 channels cannot open, making glucose go back into the bloodstream, causing a rise in blood glucose levels. This can cause weight loss because it deprives the cells from the sugar they need for energy. So your body starts burning fat instead, which causes ketones to build up in the blood. Ketones are acids that can poison your body. This is the current direction of research. So, in the current direction of research in diabetes type 1 is that doctors are not completely sure what causes the immune system to attack the pancreas. In the present day, there are many people who suffer with diabetes, and to keep control of their glucose levels, they use many devices, but not all people can use all of these devices, like they don't work on them. So there's a couple of options that people can consider, like getting a transplant of healthy insulin-making cells from a donor into your pancreas, which has a downside. It only lasts a few years, and patients need to take drugs so that the immune system of the body does not reject the cells and kill them. Another option might be getting an artificial pancreas transplant that is still being tested, but it contains a system of an insulin pump and a glucose monitor that is controlled by a computer program. Supposedly, the program sends out notifications that the person's glucose levels in the blood are lowering or rising in dangerous conditions. This is a picture of how the smartphone controlled cells look like if you don't have a donor and you have really bad type 1 diabetes. And that's an artificial pancreas that is still being tested on. And that's the work signed in.